My name is John Gordon from NewYork-Presbyterian Hospital. I'm here to introduce Dr. Lou Aronne and BMIQ. First, let me just tell you a little bit about Lou, and I'm going to read this because it's quite the background. I want to make sure I get it right here. Dr. Aronne is the Sanford Weill Professor of Metabolic Research at Weill Cornell Medical College, where he's directed the Comprehensive Weight Control Center for 30 years. He's chairman of the American Board of Obesity Medicine and the past president of the Obesity Society. He's edited National Institutes of Health Practical Guide to Obesity Treatment and has authored more than 90 papers, book chapters, and books on obesity and its treatment. Dr. Aronne developed and is CEO of BMIQ, which is the company he's here to present today. And the reason Lou's part of the New York Presbyterian family is part of Weill Cornell, and we saw a great opportunity here we have 40,000 employees, and when you look at our employees, some of them struggle with weight loss and certainly other health challenges that weight loss can affect. And we saw an amazing opportunity to look at the expertise that we have here. You know, the folks that Lou sees, he saved lives and reshaped the lives of so many people with his expertise. And we saw an amazing opportunity through BMIQ to sort of leverage that platform and bring that expertise to our employees. So we've been working to set that program up for our employees. Stay tuned. It's obviously not a 6-day process to get your employees to lose weight, but we're expecting wonderful things. So with that, I will let Lou talk about BMIQ.
Thank you very much. Thank you very much, John. I really appreciate the opportunity. I want to thank Maria. I want to thank Sunny, everybody from the Digital Health Accelerator team for helping us get through this process. I want you to meet Scott. Scott's 52 years old. He's been struggling with obesity for most of his life and diabetes for the past 10 years. He weighed 240 pounds, but felt he was powerless to do anything about it because of his love for food and his job as the manager of Zabar's. He described himself as being surrounded by crumb cake all day. Now, his doctor had told him to lose weight many, many times, but he did nothing about it. His doctor did nothing until one day he recommended that he have bariatric surgery. Did nothing, bariatric surgery. We saw Scott and recognized that some of the medicines he was taking for his diabetes tended to cause weight gain. We changed the medicine and we gave him some simple dietary advice, so simple that even the manager of Zabar's could follow it. And what happened? He lost 75 pounds and he feels great. This is a picture of him from the New York Times, an article that chronicled his weight loss. So if you ask the question, why didn't Scott's doctor do what we did? Didn't take very long. The answer to that question is the premise for BMIQ. It turns out that there are a lot of Scotts out there. In fact, there are over 100 million Americans who are obese. And they cost, on average, $1,500 a year more than a normal weight person. So that adds about $150 billion to healthcare costs in the United States. Now, before, that was okay because it was extra cardiac catheterizations, it was extra hospitalizations, diabetes care. But now, with the advent of value-based care, as we heard, accountable care, that's dropping down to the bottom line. It's costing healthcare systems money. And I think that they're going to want to do something about it. Despite the fact that obesity is recognized as a serious health problem that is very costly, healthcare professionals are not equipped with an adequate evidence-based solution to solve this problem. As a result, they're on the sidelines. Doctors, nurse practitioners are mainly on the sidelines when it comes to a patient's obesity. It's the elephant in the room. The patient has heart disease, they have diabetes, they have 40 or 50 other problems, but it's obesity that's driving it, and nothing is done about it. In fact, less than 1% of people with obesity are being treated according to evidence-based guidelines. And so we developed BMIQ. It's a comprehensive obesity treatment and diabetes prevention platform for healthcare professionals designed by experts in the field. That's us. How does BMIQ work? There are two user groups, healthcare professional and staff, and the patient, and they're linked by the BMIQ platform. The process starts with our proprietary online patient assessment. And what it finds are weight-related complications like sleep apnea, which are underdiagnosed, and as in Scott's case, medications that can cause weight gain, and it offers recommendations to use alternatives. There are many other things that are going on, but this is all we'll talk about today. It also includes educational material for both the patient and the professional. There's a 30-session program that includes meal plans, patient lessons, and videos in both English and in Spanish. And for the professional, there are instructions on how to use the system, but also how to treat the patient. There are tools for monitoring progress that both the professional and the patient can see, so weight loss, food, activity tracking, and then finally, they can communicate directly through the system using HIPAA-compliant tools for email, texting, etc. So what's the difference? You've heard about other behavioral programs for weight management, and I think that the key one is expertise. We've been doing this for over 30 years, and we've tried to build that expertise into BMIQ to get the subtlety that's necessary in managing patients with obesity. It's scalable. The platform can be used in any medical setting. It can be used online, individually, in a group setting, or one-on-one. It's available. We have programs available as low as $10 per month per professional and $1 per month per patient, and we have proven efficacy. And this is an example of one of the studies that we've done, 150 employees of a county in Virginia using BMIQ for 6 months. The mean weight loss was 6.5%, body weight 15.9 pounds, and a reduction in waist circumference and all of the expected improvements in blood sugar and lipids. This entailed 2 live visits with a registered dietitian, 5 phone calls of 15 minutes each, 12 online group sessions, and gym membership. We have a host of current and prospective clients through both of our business models, licensing and care delivery. For example, Brigham and Women's Hospital is using BMIQ to deliver a PCORI-funded intervention of 840 patients across 24 sites. They're using a population health model with central care of those patients. And then at Weill Cornell, we use BMIQ to manage all of our patients remotely and in the office, and we hope to soon be using it for the New York-Presbyterian employees. We're currently using it for the Weill Cornell employees. You see we have a number of prospective clients we hope to work with shortly. Our target user base is large, over 100 million adults, with only 1% being treated according to guidelines. And there's an inflection point that we believe will be occurring in 2018 when Medicare will be covering behavioral treatment of obesity. Insurers are beginning to cover it as well. And we have over 450,000 healthcare providers who we believe would be good targets. So we have a virtual army of people who are ready to deliver the program. They know that their patients are suffering from obesity, that it's driving the problems that the patient has, but they don't have the resources, they don't have the knowledge to do anything about it. This is our team. We're very lean, but we're not mean. We're not mean, and we would welcome you. Whether you're an institution or an investor, we would welcome you to help us solve this problem. Thank you very much.